Here at KPCB, we are very active in digital health and IT-enabled services in healthcare now. We've always been interested in the sector for the past 10 or 15 years, but the ingredients were not there that enable it now. Ingredients like mobile, pads, doctors' use of those, the cloud, SaaS-based revenue models, adoption by doctors and hospitals and even insurers of all of this, and their desire to see more innovation. Examples are like companies that are working on big data in the cloud to ingest the 500 sources of information that product managers, clinical trial managers need to look at IMS data, journals, Salesforce.com reports, internal reports, R&D innovation, all of that, and put it together in a way that's visualizable with natural language processing. Another example are apps on the phone for consumers. Patients only adhere and comply half the time to the drugs that are prescribed to them. That's a huge problem in clinical trials and a huge problem later. Only 60% of the time do patients who have been asked to go have a blood draw for lab tests adhere to that and go do that. And then the data that comes back only goes to the doctor in most workflow, not to the patient. So imagine what changes that would bring. And then there are apps that are used up to 60 million users about fitness, diet, nutrition, and so on. So those are all happening on their own. And then imagine, where does all this data go? And who uses it, and how is that put together? So this is very exciting in this time, and it's multidisciplinary. Is that digital health companies need the expertise of the doctors, the providers, the medical experts, combined with the expertise of digital software engineers, workflow analysts, cloud, IT platform. So it's very exciting to see how these teams are coming together in an unusual and multi-experience way. That is the essence of the principles of biodesign, in my view. Biodesign has always adhered to this process and set of principles that you start with the need and you work backwards, and it has to be an interdisciplinary, multidisciplinary team. It gets to what I call recombinant innovation.